Welcome, everyone. My name is Haley Buckner, and I'm the Professional Relations Manager for Elevate Oral Care. Thank you for joining us this evening. Before we start, I'd like to cover a few housekeeping items. For those of you who remain online past 50 minutes, your CE certificate will be emailed within hours of the completion of this talk. Be sure to check your spam folder. You are all muted, so there is no need to worry about background noise. We will have time at the end for questions, and you can submit questions on your webinar dashboard as they will be tracked throughout the talk. We have hosted an extensive series of free live CE webinars on many prevention topics. Each of these webinars were recorded and are available with free self-instruction CE at elevateoralcare.com/elevatingcare. Bookmark this page and return often to see what's new in free CE. Also, if you have a topic you would like to see covered, feel free to suggest it by sending an email to info@elevateoralcare.com or by completing the webinar survey that will be sent after the completion of the talk this evening. We enjoy looking through your suggestions and creating webinars based on your requests. Tonight, we are honored to be joined by Ms. Whitney Howerton. Whitney Howerton is a clinician, educator, international speaker, and the Senior Manager of Clinical Education and Innovation for Paradise Dental Technology, or PDT. Whitney has shown her dedication to the dental hygiene profession through multiple leadership roles on a local, state, and national level. With experience as a full-time clinical and didactic instructor teaching a wide variety of courses, including local anesthesia, head, neck, and dental anatomy, special patient care, and advanced instrumentation, Whitney loves educating students and colleagues alike. In addition to her role at PDT, she currently serves as adjunct faculty in the dental hygiene department at the University of Tennessee and practices clinically for a general dentist. She has built robust clinical education programs for both dental manufacturers and comprehensive healthcare centers, focusing on the importance of improved patient outcomes and providing safe, quality care. In her free time, Whitney enjoys cooking, traveling, and getting lost in a great book. Thank you so much for being here this evening, Whitney, and I'm going to turn it over to you.
Thank you so much for the introduction. This class is Edge to Excellence, Gaining Confidence in Sharpening Techniques. So today's presentation, we've got some objectives, right? Because sharpening is really challenging. I feel like a lot of us as clinicians aren't always comfortable with sharpening instruments, or maybe we feel really good about a sickle and then we get to some of our curettes or we get to some of our area specifics and we're like, oh no, we kind of panic. So our objectives are to recognize signs of instrument dullness, implement sharpening techniques to make sure that we are being timely in how often we're sharpening, also identifying and differentiating between the various instrument designs and their specific sharpening needs, and then also applying those sharpening techniques to make sure that we have sharp cutting edges. There's so many benefits to us as clinicians, as well as to our patients when our instruments are sharp, and then how to best implement these practices into your daily and clinical routines. So, a few disclosures before we get started. I am a full-time employee of Paradise Dental Technologies. I serve as the Senior Manager of Clinical Education and Innovation at PDT. I'm also adjunct faculty at the University of Tennessee Health Science Center here in Memphis, Tennessee, where I am based. And then also I do still practice clinically as a temp hygienist whenever time permits. So that's a little bit more about me and the disclosures that I wanted to share with you all today. So before we even jump into instrument sharpening, we have to go back to the basics. Like we have to refresh on instrument design and some of the things we've probably forgotten since we were in school. So let's jump back to the basics first. So when we look at instrument design, I really feel there are 5 main components that we want to make note of. Number 1, does our instrument have a tip or a toe? Where is the lateral side? Where is the face? Those two are probably pretty obvious, but the reason why they're so important is because the lateral side and face, where they meet, is what creates our cutting edge, right? And then what's the length of our cutting edge? Because depending on the instrument design, it may have a mini blade, it may have a really long blade, or it might have a little turn or twist near the heel of the blade. So, really, how long is this cutting edge? Because you have to make sure you sharpen each component of it. And then also, that fifth component is the terminal shank. That is critical when it comes to sharpening instruments correctly, is where is your terminal shank? So let's look at some of these areas that we just talked about. So this image here shows a great kind of lateral view of an instrument, and you see that the toe of the instrument is highlighted there. That's a pretty obvious one. You also see that the back of the instrument is mentioned, and that's key too, especially if you're using a sharpening device. You really have to remember how to position the back and the lateral side, and where is the terminal shank. So it's all over the place. You have the face, that direct part that we look at when we're directing our instrument. Also, you have the tipper toe, you have the middle, you have the heel, you have that full length that we just mentioned, and then you also have that terminal shank, and that varies in length, the bend, the location. So we'll get into that too, because I really want you to gain a lot of refreshers when it comes to being confident in sharpening your instruments. Let's kind of continue on with some of our basics. So when we're looking at the instrument from a tilted view, kind of from that lateral side still, now you can see that face directly. Those white lines indicate the cutting edge. So that is where that lateral side and face meet, and that is your cutting edge. So what's the width of your cutting edge, or what's the width of your face, the length of that edge, what's the thickness? And then also, we indicated shine here because I think it depends on when you went to school. Shine, maybe you were taught to look for shine. So shine appears when the cutting edge begins to become round, or not sharp and as crisp as it should be. So then light begins to reflect. So I know me, even with my loops on, it's really hard to detect shine. So I don't use shine as a means of determining when my instruments are dull versus when they are sharp, but I know a lot of clinicians that do. So I don't encourage you to try that method or start that method if that's not what you've really learned on, because sometimes it's hard. And depending on your operatory lighting and whether you have loops on or not, it gets really challenging. Also, we have another view there to the right, just showing you the width of the face, length of the face. The face is the full length, from the toe, middle, and heel of the instrument. And then what other characteristics might we need to refresh on as we're thinking about the basics that we learned in instrument sharpening? We can't forget that a sickle is triangular in cross section, and we have two cutting edges there. We have a universal curette that has two cutting edges, but it does have that rounded back or toe, that you see there. And then also the Gracie or area specific curettes have one cutting edge that's at that 70-degree angle. So you have a cutting edge and a non-cutting edge. So all of the tips and toes have been removed from these. So you could really see that design of the instrument to really refresh and kind of remind ourselves how those instruments are manufactured. Now that we've refreshed on our basics, how do we actually know, or how do we actually identify that our instruments are dull? There are a ton of ways, okay? Number one, when our instruments are dull, we have to make more effort. Like we feel that, like our fingertips and our tactile sensitivity tells us that we're making more strokes, or we're not biting as effectively. Maybe we're burnishing calculus versus shearing it or popping it away. So the image depicts, a nice sharp cutting edge. You can adapt under that deposit and you bite or shear the deposit away. Versus if it's a rounded or dull cutting edge, you're just removing it layer by layer, which is really burnishing it, and then trying to go back, grabbing your ultrasonic, grabbing a different instrument trying to remove that remaining deposit. Unfortunately, we all don't have, perioscopes, which are so phenomenal at being able to see what's happening subgingivally where we can't see. Also, you may begin to notice once your instruments are dulling that your hand or wrist starts to have a little bit of ache to it. You might be increasing your pinch that you're using, and your lateral pressure that you're using to remove calculus. And then ultimately, it may take you more time to treat your patient, especially when you're doing a lot of hand instrumentation, or your patients might tell you or the dentist or the front office staff that it was uncomfortable today, or that my clinician was rough today because the instruments are dull. So there's a lot of ways physically that we can tell by our touch and our pressure, as well as clinician results when our instruments have begun to dull. So, what are you doing currently to sharpen your instruments? So just think for a moment like, oh man, number one, when is the last time that you sharpened your instrument? Number two, how are you currently sharpening them? Are you comfortable and confident in the techniques that you're using? Are you using hand and stone? Are you using a device? Like there's so many things out there. So we'll look at that too in just a moment. But how are you currently sharpening? And are you confident and comfortable in your abilities? So I wanted to review kind of the traditional technique using that hand and stone method. This is how I was personally taught when I went to dental hygiene school several years ago. And I know a lot of clinicians that were taught this way as well. And then now there's so many fantastic devices on the market that have really been around forever. But I don't feel like as a student, that I was taught how to use any of the devices. It was really a focus on the hand and stone technique. So if we look at the depiction in the article from Hodges, it shows you proper angulation of the stone versus improper angulation of the stone. So the image to the left, we've got perfect angulation there, about 105 degrees. And then if we're keeping the stone at that perfect angulation, we're going to get the correct angulation of our cutting edges, which is about 70 to 80 degrees internal angle. So that's what the light blue color that you see, that 70 to 80, that depicts the internal angle that you want for an ideal cutting edge. Now, I don't know about you all, but it's been a minute, maybe high school, since I took geometry. And geometry can be hard. So if I were to walk up to you and say, show me 105 degrees, like with your hand or with a piece of paper or a pencil. It's kind of tough, right? So, hand and stone technique, people can get off. They can over angulate, like you see in section B there. The stone is over angulated, so greater than 110 degrees, which means now your cutting edge is going to be way off. It is going to be less than 70 degrees, and you're not really going to be able to be very effective at all with your instruments. Then if you get to item C there that you see, you don't have enough angulation. So if it's less than 105, if your stone is kind of staying parallel to the instrument, then you're not going to have that cutting edge. So let me show you what that looks like in some images in just a moment. But this is how I was taught. You stabilize your instrument in your non-dominant hand, you adapt that stone, hopefully in the correct angulation, and then you're able to work, heel, middle, tip, or toe of the stone. You would end on a downstroke on the side of the tip if it's a sickle, and then you would round around that toe if it was a universal curette. And if it's a Gracie, normally you have to position that stone. And, there's a lot of different techniques that go into making sure that your instruments are correctly sharpened. And then, of course, you want to always remove that residual metal deposits that may be left on your instrument after you've sharpened. So this is what it can actually look like with instruments. So correct angulation, and again, the tips and toes of these instruments have been removed. So you can see the kind of cross section of a properly sharpened instrument versus one in the middle there that doesn't have enough angulation. See how it's kind of blunted there on that left side. And then on the image at the bottom, it's way too much stone angulation. So what we did wrong here was perfect, not enough, or too much angulation. So again, when you're kind of visualizing and you're looking at, you're like, geometric acuity. When you have a stone in your hands and you're trying to line everything up, it's really, really challenging to keep that stone at 105 degrees to make sure you have that perfect angulation. Also, like visualizing a clock can be super helpful if you're using your hand and stone technique, but it can also still be challenging. But that clock technique really does help. But I find what's even more helpful is having some type of device to assist me to keep me at the appropriate angulation and serve as a guide. I mean, that's really ideal. So then I know that I don't mess up. And or when I was teaching my students, it was easier for them because they didn't mess up either. So, when should you sharpen? And that's probably the question that I get the most often, to be honest. When do you sharpen? How do you sharpen? What do I use to sharpen? All those questions come up, but how often and when should I sharpen is by far the most common one. And there is research done by Moses and several of Moses's colleagues that says instruments may begin to dull or the cutting edge begins to round after just 15 strokes. That's not very many strokes, right? If you think about, if you think about your current instrumentation, that's not very many strokes, especially if you love to use hand instruments like me. I also love ultrasonics too, but I love to use my instruments. And 15 strokes, not very many teeth. So think about there's a lot of factors though, right? How pillowy is the calculus versus how tenacious is the calculus? What's the size of the deposit? Is your instrument already dull, or are you starting with a fresh new instrument? But the research does say that the instruments can begin to dull after up to 15 strokes. And again, when instruments dull, it's that rounding of the cutting edge that's appearing, so we can't bite and scale as effectively. Also, you want to utilize your test stick or a ping ring to make sure that you're checking regularly for sharpness. So that's another way to tell when your instruments are dull. Not only may you get the effects on your hands, or your patient may comment, or you're noticing it's taking you more strokes, but you also have tools out there such as a test stick or ping ring to actually check the sharpness. Also know a lot of clinicians use like a low volume suction. You can also use that to check your effectiveness, but I really like a test stick or a ping ring, having that hard material to really truly get a good detection. Also, when it comes to sharpening your instruments and really instrument lifespan, if you have achieved a 20% reduction in the width of your instrument, like the width across the face of your instrument, or the length of the blade has been reduced by 20%, that means it's time to replace your instrument. So they don't really last forever, everybody. I know we tend to keep our instruments much longer than we should, but about a 20% reduction across the width or face, as well as the length of the blade, means it's time to replace your instruments. Now, what sharpening devices can help us? There are so many different devices out there. So, I want to go over some of them. And this is not a comprehensive list, but there are so many different devices out there that can actually help you improve your sharpening technique. So you have a Gleason guide by PDT. You have Sidekick by Hugh Freedy. There's a Ergo Sharp by DH Cubed. There's Diamond Sharpening Cards by Hugh Freedy. There's a Sharpening Horse that was designed by Dental Hygiene Methods of Education. You have the Disc Sharpener by Premier Dental. There's a Rondo Plus by LM. There's the Insta-Renew by Nordent. Gosh, if I just pause for a minute and think, what else is out there? What else have you used? What else have I used? There's Periostar by Kerr Hall. There's a new device called the Speed Wheel that was designed by a dental hygienist. Actually, a lot of these were designed by dental hygienists and dentists, so that's cool. And then also there's so many other things, right? There's honing devices, and I've heard a lot of clinicians say that they were taught to use a high-speed handpiece and a burr. So that is not the technique that I like to use because I fear that I would, really damage my instrument or ruin my instrument. So no matter what device you're using, or even if you're just using a stone in your hand and you're good at geometry and you're really, good at those angulations, always be mindful of the pressure that you're applying when you're pushing pressure on that stone. And then also just be mindful of the number of strokes that you're using, because I feel like sometimes we think that we have to do several strokes to make an instrument sharp again. But sometimes if you're touching them up pretty regularly, once a week or every few days, you're only making three or four strokes, and then you're where you need to be. So use your test stick or your ping ring, and you're checking for that sharpness instead of over sharpening and removing excess metal, which then affects the lifespan of your instrument. So there are so many different devices out there for you that you can utilize as a clinician. What about the stones? I also get a lot of questions about this. So apparently I get a lot of questions about instrument sharpening, and that is why we are here doing this class together. So what stone should I choose? So let's have a refresher on sharpening stones. So as you look at these stones, Arkansas, India, ceramic, diamond, do you have a favorite? Did you know that you had to use different lubricants on some of them? When it comes to these stones, like an Arkansas stone, for example, it is a natural stone type. Most of the time, Arkansas stones are used. There's a fine texture type stone, so it's used for finishing or kind of, touching up when you're not neglecting yourself and you're sharpening on a regular basis. But Arkansas stones do need oil as a lubricant prior to sharpening your instruments. Also, when it comes to ceramic stones, they're a type of synthetic stone, and you have a lot of variety in that. You have fine that's used for finishing, you kind of have a medium grit, or you have a coarse grit that's used to reshape or recontour an instrument. And with ceramic stones, they don't require any type of lubrication. So no water, no oil, nothing like that's needed. You also have diamond coated stones or cards, and it's basically an industrial manufactured diamond that's bonded to, maybe on a stainless steel card. Those also vary. You have fine, medium, coarse grit in those for finishing or recontouring, and they don't require any type of lubrication. Or maybe you have an India stone. So your India stone is often a natural stone, typically a medium type grit or medium type texture for reshaping or recontouring, and it also requires oil for lubrication. I have seen some synthetic type India stones, so just make sure that if you found a random stone in a drawer, which I think happens more often than not sometimes, you all. When you find that random stone in the drawer, or maybe you started at a new practice or a clinician that you work with brought a stone with them, make sure you know what kind of stone it is. Is it a natural stone that needs some type of lubrication, or is it a thin synthetic ceramic stone that doesn't require any type of oil or water? And then another key thing that I have to encourage you to do and make sure that once you've identified the type of stone that you're working with is following the manufacturer's instructions for use when caring for your stone. All of these stones can and should be autoclaved before use on your sterile instruments. Please don't, use your stone chair side and toss it in a drawer, because I get that question too. Should I sharpen chair side? Or, what should I do if I'm using an instrument chair side and it's really dull? Like, what should I do? So that question comes up quite a bit too. And the thing is this, if you're using a synthetic ceramic stone, you can absolutely sharpen chair side. Even after that instrument has been used, there is research out there that was published in the Canadian Journal of Dentistry that shows, basically a new stone that hasn't been used, a stone that's been used chair side, so there biofilm or blood that was on that instrument, and then after sterilization, you see that all of that has been completely sterilized. So always make sure that your stones are sterile, especially if you're using them uh, during patient care, sterile instruments, sterile stones. And that way, also, if you unintentionally stick yourself, I like to sharpen with sterile instruments and a sterile stone. I don't love to sharpen chair side just in case a slip happens and I'm not sticking myself. So just be careful, follow your manufacturer's instructions for use, take care of your stones, use lubricant when you need to, but always, always, always sterilize your stones and your sharpening guides. If there may be components that can be sterilized or components that cannot, so make sure you follow those manufacturer's instructions for use for sterilization and or disinfection, depending on the device. Now, if we look at sharpening each instrument type, and I'm actually going to show you a live demo. I have everything set up here in front of me using one of the instrument devices that we looked at previously, because I really want you to get a feel for, I guess, just having a guide or tool to help you. But before I actually show you some sharpening, let's talk about and review sharpening of each instrument type. Right? We have a sickle, we have a universal curette, and then we have an area-specific curette or Gracie. Before we can jump into sharpening, and I mentioned this before, we can use a test stick or we can use a ping ring. A lot of people use a low volume suction to check for sharpness. Is my instrument sharp? But I find that a lot of people don't do that correctly. So I wanted to put a picture on here for you. Whether you're using a test stick or a ping ring, you have to make sure the key to really knowing whether your instrument is dull and needs to be sharpened is adapting the cutting edge to the test surface. So, like this image shows a ping ring. And if you notice, the cutting edge or the terminal shank, the functional shank, and the handle are pointed in a downward direction. So that allows for the cutting edge to adapt to the test surface. If you're using a test stick, it looks kind of like a plastic piece of chalk, like a blue plastic piece of chalk. I've also seen some other colors, but it looks the size of a piece of chalk. If you're using a test stick like that, the way I used to teach my students when I would teach instrument sharpening is think of it like a tooth. If you're using a test stick, position it vertically. If possible, you can fulcrum on the top or fulcrum on the side. And if you're fulcruming on the side or the top, as you work into it, you can actually adapt that cutting edge because it puts you at a good angle to make sure that you're not just rubbing or staying parallel with the test stick or parallel with the ping ring, and you're just rubbing or scraping across the test surface. You have to add that angle to make sure that your cutting edge is actually adapting, just like you make sure your cutting edge is actually adapting to the tooth surface. You can't keep it perfectly parallel. You have to turn into that tooth surface or adapt that cutting edge to the deposit or surface. So visualize a tooth, adapt the cutting edge, and then you can actually ping or kind of make that tick with your toe middle heel or your tip middle heel and make sure that it's actually sharp. Otherwise, you're kind of redulling your instrument by just trying to scrape off the plastic. Like that's not the goal. The goal is not to have little plastic ribbons curled up at the end of your ping ring or curled up at the end of your test stick. That is not the goal. That would actually start to redull your instrument. So just a little pro tip there before you get started. So back in the very beginning of the class, we talked about the basics, the lateral side, the face, the length of the blade, the terminal shank. So when you're sharpening instruments, you have to know where the terminal shank of the instrument is. It's really critical, especially when you're sharpening your Gracies, because you don't want to sharpen both sides, right? A Gracie only has one cutting edge. So I just wanted to pull a few instruments, from the archives and show you, and kind of even just simply with arrows, where is the terminal shank? And I'll show you when we actually do the demonstration too. So when you look at a sickle, this particular sickle, The terminal shank, kind of indicated by that blue bracket, is right there at that first bend until the blade begins. You look at the middle instrument, that is a universal curette, has some beautiful bends there. Same thing, second bend from the second bend to the top of the blade. Same thing with that blue bracket. And then you get to a couple different Gracies now. The Gracie with the purple handle definitely has an extended terminal shank. So it's a long one, right? Right there from that second bend all the way to where the blade or cutting edge begins. And then you get into that last instrument several bends just before you get to that cutting edge. So always know where your terminal shank is. Not only is it fantastic and necessary for instrument sharpening, but if you pick up an instrument that you've never used before, maybe you're temping or you found something online, you're like, ooh, I just want to try something new. You can always figure out how and where to use it as long as you can identify that terminal shank. You can position that shank at 12 o'clock. You can see whether you have one or two cutting edges. You can put it parallel to the teeth interproximally, and you can figure it out. So have confidence in trying new things too, because as long as you know where your terminal shank is, I promise you can figure it out. And if not, just reach out to me and I'll help you. So let's look closely at sickles, curettes, and area specifics, and then we'll do our demo. So when you're sharpening sickles, don't forget that many of the sickles, or really all of the sickles, have a triangular cross section. So that shows you here, and with that kind of black triangle depiction, you have two cutting edges, and the terminal shank to face relationship is 90 degrees. Easy breezy. Sickles are so easy, typically, to sharpen. You also have a jaquette there to the right. So still triangular in cross section, still that 90-degree relationship, but I just wanted to show you that it is slightly different and how the back of that instrument is designed. Then when you look at a universal curette, now I'll say this. I feel the Columbia 1314 is a challenging instrument to sharpen. So I'm actually going to show you that instrument because it can be challenging. And then if you think about what's similar to a Columbia 1314, but in the sickle world, that would be like your 204S. So sometimes that can be challenging to sharpen. But sickles, because you're kind of keeping that straight line, just tend to be easier for people in general. When you get to that universal curette, I think a Columbia 1314 can be challenging to sharpen because you have the internal cutting edge and then you have an external cutting edge. So when you have the external edge, maybe the handle's pointing at 11 to 10 or 11 o'clock, or the handle's pointing at like 1 or 2 o'clock. That external cutting edge is the one that's just right there lined up with it, and you're able to sharpen pretty easy. When you get to that internal edge, it's the one that's like tucked under handle. And that's where it gets tough, especially when you're using like your hand and stone technique and you're trying to line up those angles. That can be very, very challenging. So I want to show you how having a guide or a device can help you. But just a reminder, curettes have that like beautiful half moon or crescent shape in cross section. So you do have to round the toe. You want to keep that toe nice and round, or you're going to turn all of your universal curettes into universal sickles. Or if you don't stay straight with your sickle, you're going to turn that into a curette too. Two cutting edges on a universal curette, so don't forget to sharpen both sides. Then when you get into sharpening area-specific curettes, like a Gracie curette, the biggest thing is, where is the cutting edge? So we've talked about that. We've talked about that in identifying the terminal shank. When you figure out the terminal shank at 12 o'clock, specifically with the Gracie, you're going to have that slant, right? You're going to have a lower cutting edge. So I always used to teach my students and our colleagues in the dental profession, pick the end, put the toe toward you, keep that terminal shank, not always the handle. It really depends on the instrument. Like if it's a Gracie 1-2, your handle and your terminal shank are going to be in line with each other. So yeah, your handle will be at 12 o'clock, because your terminal shank is at 12 o'clock. And that's using that clock position that we talked about earlier too. Hold it at 12 o'clock, and you're going to see an angulation. Is your lower cutting edge to the left, or is your lower cutting edge to the right? If it's to the right, we're only going to sharpen that side, and then we still have to round our toe because it's a curette. If you're looking at a posterior Gracie, let's say it's your Gracie 15-16 or your Gracie 11-12 or that crazy bendy 17-18, same thing. Put your terminal shank at 12 o'clock. Your handle's going to be pointing over here at a 10 or 11 or 1 or 2, depending on which end you're looking at. Keeping that terminal shank at 12 o'clock, you can see which is your lower cutting edge. So the depiction that you see to the left there just reminds you that it's a 70-degree angulation between the terminal shank and the face. So you do have a lower cutting edge, only one. And that's the one that we should be using to treat our patients, as well as the one that we should be sharpening. So I want to pause for a moment, and I want to share my screen so you all can actually see a demonstration of how to use just one particular device on the market. So if we look at this example, and again, there were so many different devices that we looked at on that one slide. So this is just one example of a device or guide that can be used to assist you in sharpening. So I wanted to just quickly go over to kind of help you gain some confidence. If you decide to use a device or guide to help you, absolutely make sure that you follow that device or that guide's instructions for use. I also encourage you, if you have any like dull instruments laying around in a drawer, maybe you dropped one or something happened and one end is broken, practice on those instruments that you planned on recycling or putting in the sharps container one day. Practice on those, especially when you add a device or guide that you've never used before. So I just want to show you how simple some of these devices can are to use, and also how easy they can make your life, which is great. So, for example, this device is called the Gleason Guide. One side is for universals and sickles, while the other side is for a Gracie. So, this guide could be placed on any stone of your choice, fine, coarse, medium. Any stone of your choice. You just want to make sure that you've lined up this opening here. This is called the rest. This area is called the stop, that you've lined this up over your stone of choice. Now I'm going to start with the Gracie because we just talked about the Gracies. So in this instance, I have a Gracie 13-14. I have identified the 13 end. My terminal shank is at 12 o'clock. And my lower cutting edge is here to my left. So I would select the Gracie side, kind of tuck my fingertips beneath the stone. I've lined up the Gracie side with the stone, and this lower cutting edge is to the left. So I'm going to stop here by positioning the back of the instrument on the stone, and the terminal shank is actually touching the stop. And then what I do is I rest the terminal shank until it touches the rest. So the terminal shank, if I change my angulation a little bit, the terminal shank is touching the rest. The back of the instrument is touching the stop. And then it's all about your wrist at this point. I'm making kind of a pendulum type swing. So if I put my wrist kind of in view, you can see that I'm not just going straight. I'm kind of thinking in my mind, toe, middle, heel, toe, middle, heel. That's kind of how I like to do this. And so this side, now I would check. Probably going to be hard for you to hear the click since we're on a video together, nice and sharp, but I do need to round the toe because if you notice, I didn't round the toe yet, right? So I back up to this kind of angled end or this toe shaper end. Remember, my cutting edge was to my left. So I position the back of the instrument and adapt that toe down. And I just make a small kind of fishtail motion. So this is where us knowing how to roll our instruments as we roll interproximal really helps. And then I just like to check again and make sure it's nice and sharp. But again, while we're in this position, I want to show you, if I were to keep this cutting edge nice and parallel, scrape, 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 it's going to sound like it's dull and it's going to just slide right off. If you actually adapt that cutting edge, so you're adapting into the testing material, then you can actually see whether your instrument is sharp or not. So that's critical in how you use your test stick or your ping ring or whatever material you're using to test. So now I want to show you how to do a sickle. Like I said, that's one of the easiest things to do. So exactly like we did the Gracie, you're going to position, you're going to have that terminal shank touching the stop, which means the back of the instrument's touching the stone. Then you rest the terminal shank on that outer rest. You always want to keep those 2 points of contact. And then I'm going to slide back and forth or glide back and forth. I'm going to check. Maybe I need a little more there on that side of the tip. So I'm going to stop and rest, reposition. And I'm going to go ahead and do the other side too. So don't forget to do the other side. Rest the terminal shank there. Drop the terminal shank onto the rest. And then you're able to check on your testing device. And I want to quickly show you a universal curette because I promised you that I would. So with a universal curette, and like I said, I got the Columbia 1314 because sometimes it is tough to sharpen. So external cutting edge, internal cutting edge. So when you're sharpening the internal edge, you're going to rest the terminal shank against the stop, drop the terminal shank down. Now, I will say this, with this particular sharpening guide, it's better to hold it in your hand. Tuck those fingertips in, hold it in your hand. That way, when you rest the terminal shank down, if you were to put this on a table, it's going to hit the table and you're not going to get low enough. So that depends on the type of device or guide you're using. Some of them you need to hold in your hand. Others you can actually position on a table. So really read those instructions for use. And then I'm going to do that nice wrist swing motion again. And like I said, I'm thinking in my head, side of the toe, middle heel, just like you would if you were using hand and stone. Now your other angulation, you rest your terminal shank, drop that terminal shank until it touches. And then because it's a curette, use that toe shaper, position the back of the instrument where the toe is touching, and round, round, round that toe. And of course, I'm going to check. And I'm ready. I'm ready to scale. So I hope that visual demonstration was helpful to you. There are so many devices again on the market. So I'll give you my contact information to make sure that you can reach out to me. I'm happy to help you figure out how best to sharpen your instruments and make sure that you're doing it correctly. So let's wrap up with why. Well, I guess not why, but what do we need to do after we've sharpened? Okay. So after we've sharpened, we're not just done, right? Even if our stone was sterile and our instruments were sterile, we're not just like, all right, I'm ready to use this on the patient that's maybe sitting in the lobby area that I'm going to go get in a second. Or what I like to do is I like to sharpen if I have a cancellation. So then I have time to re-sterilize everything before, because I really don't want to I want to make sure that I really truly don't put metal shavings, into the sulcus of my patient's periodontal pockets. So I like to sharpen when I have a cancellation. And then that way I can re-sterilize everything. But there is some post-sharpening instrument care. So when it comes to after you've sharpened, you want to make sure that you're using a piece of gauze or some type of similar product to remove that residual metal debris prior to using those instruments on your patient or prior to sterilization. So I wanted to share a couple adjunctive products that I really like. to remove that residual debris. You can absolutely use a piece of gauze. I do encourage you to, put that piece of gauze like flat on your tray or counter, hold it down with your fingertip on one corner and then wipe your instrument as opposed to picking it up and then wiping that way. You want to reduce any opportunity that you could have gotten stuck with that instrument. So put it on your countertop or tray, hold it down, and then you can wipe. Or there's a couple other adjunctive items that I really like on the market. So I like the free hand ring by Pura Dental Products. It was designed by a dental hygienist. And she designed this with a couple things in mind. Number one, there's a sponge side or a sponge option that could be worn chair side to remove biofilm or plaque. I'm sorry, that's the same thing, y'all. Biofilm and plaque, or calculus that's remaining on the instrument. So you're really starting your cleaning process chair side. So you're not taking all that to sterilization with you. So I like to use that sponge to wipe off any biofilm or blood or calculus that may be on my instrument. Or I like to use the sponge, a clean one, to remove those metal shavings from my instrument. So that's super handy. And the ring portion of it's autoclavable, which is nice. And the sponges and the wells come in multiple packs. I also like that there's a well option. So I did go ahead and include this one so you could see it. So if I'm applying my, Floramax fluoride varnish, I can put however much I need in one well and then use my, micro brush to apply however much fluoride is needed. So I do like that well portion. Also, like if I'm applying SDF, like Advantage Arrest, then I can put that in that well and then use my applicator to apply silver diamine fluoride. So I really like this device for removing the metal shavings, that residue that could be on my sharpened instruments, but also for my fluoride varnish application or SDF application because of that option to have that well there. I also really like the Fit and Swipe cleaning pads by Hager Worldwide. I do like those as well. They stick on the back of your glove. And you can do the same thing with those. So you can stick it on the back of your glove. You can use it to wipe to remove biofilm, blood, or calculus that may be on your instrument, or you can use a clean one, right? Use a clean one to wipe to remove the metal shavings from your instrument. So those are a few additional items that I like to use that I incorporate into my clinical practice as well as my instrument sharpening techniques. So as we begin to wrap up, the importance of sharp instruments. Gosh, there's so many. Okay, these are just a few, right? When you have a sharp instrument, it benefits you and it benefits the patient, right? So you would have increased tactile sensitivity because your instrument is sharp. You have a nice thin cutting edge. You can make fewer strokes to remove a deposit because you're able to adapt that cutting edge under the deposit, shear or fracture that calculus away. Less pressure is required when your instruments are sharp because they're doing their job and you're able to be more effective with your stroke, right? Also, that helps reduce hand fatigue, hand or wrist fatigue. You're not pinching as much. You're not making as many strokes. So it's really helping you ergonomically. Improve patient comfort. We kind of talked about that at the beginning, is that a patient may complain like you're putting pressure or maybe it was more uncomfortable when your instruments are dull. So there can be improved patient comfort when you have sharp instruments. And then also ultimately, when you have a sharp instrument, you have more control. Because when you have a dull instrument, you have a risk of slipping off the tooth, especially when you're having to put more lateral pressure. So a sharp instrument and reduced amount of pressure required gives you more instrument control. So I really hope that you enjoyed Edge to Excellence, really honing your sharpening techniques and really gaining confidence back in instrument sharpening. And if you want to connect with me, I'd love to hear your questions. You can connect with me at clinicaleducation@pdtdental.com or shoot me a message on Instagram. It's Whitney H _PDT.